You are watching the Doctalk show.
So we want to now know what could be the do's and don'ts, how you should handle a patient as you wait for an emergency service to reach you, emergency service like Lumia. What should we do? Imagine you are at home and then maybe you find your grandma unconscious, or you find your child is choking, she was eating something and you can't breathe. What should you do? What should you not do as we wait for the emergency experts to come? So I don't know, maybe Dr. Hawa?
Just to give a general outlook on some of the do's and don'ts, depending on how we get patients at the emergency units, where I've worked and I think you've worked as well. Generally, in our society, when someone convulses, people try to put something in the mouth, right? Or the baby's mouth to stop the convulsion or to stop them from biting their tongue. Please don't do that. Do not put anything in anyone's mouth that's convulsing. It will not help. It will just hinder their improvement, maybe even exacerbate death, right?
Okay, that's in the scenario of convulsing, you know.
Yes.
But what about when they're like maybe an accident and then I don't know, like any emergency.
Let's talk about trauma, for example. If somebody gets trauma, we suspect in emergency pre-hospital care, we suspect that person to have had spine injury. So we will give you instructions not to move the patient, because you moving the patient, you will be aggravating the injury.
Okay.
If you break their spine, then you're permanently getting
the
them
bones of the back?
Yes, yes.
But which part of the spine? Because people may not know which part of the
So
spine.
the damage can be anywhere from
anywhere.
neck to the back of the chest to the actual back up till the lower end of the back. Yeah.
So that spine can break in trauma.
Yes.
So people shouldn't just move patient.
Yeah, it's better to leave the patient where they are and stop the bleeding. Yes, because bleeding may kill them. But if the bleeding is stopped, there are very simple ways of stopping bleeding. Hold the bleeding part, tie a tourniquet, or what could be a cloth, could be anything that can tie. If the handkerchief is strong enough and long enough, tie it before the bleeding point to stop that bleeding, right? Or to stop bleeding as much as you can before the emergency providers arrive.
Okay.
Yes.
You just don't watch the patient bleed out like
Most of our people would love to put someone on a board and rush them to the hospital. That, I know they're helping, but that doesn't help. Actually, it's more detrimental to them.
Detrimental. They are taking the patient quickly to the
Okay,
hospital.
if let's say
there's been in an accident, you know.
I understand. Let's look at
Life is
somebody.
going,
Let's look at somebody who is unconscious. The person who is holding them and putting them on border, the person who is unconscious will always try to block the airway.
They'll be like
yes. If you carry them and you think you're helping and taking them to the hospital, by the time you reach the hospital, they have not been breathing. They will be declared life extinct
because they have
not been
position
breathing.
is bad.
Yeah, breathing will kill the patient. Bleeding will kill the patient.
So in that scenario, what should people do? They should. When
they call us, we will give them instructions on how to clear the airway, stop bleeding. When we come, we have the skills, the equipment, the tools and expertise to deal with that patient. What will kill the patient is the breathing, bleeding, circulation, and then of course we'll talk about disability, but that will be later. That's why we don't want them to move the patient. You will constantly be surprised how many people you can pull back from the jaws of death.
Yes. Especially in accidents.
And also it's very important to keep the person safe and also to keep the bystanders safe, sorry. So it's not important, like in our situations when an accident happens, that's the first thing people do. They come, crowd around the situation, stop traffic, you know, it's crowded, there's not really any help coming through. If I come with the ambulance, I have to struggle through the crowd. Everybody wants to know what's happening. Are they going to die? Is this happening, you know? So what you can do is keep the person away from a crowd. Exactly. Keep the area safe. I mean, if it's like a gun shooting, I don't want a bystander. I won't tell someone, you know what, go and remove the patient while there are still shooters. No. It's important to always keep your safety in mind and the safety of the patient. Yes.
So I'm just imagining accident victims, maybe in a border accident, and they just bundle them up into, you know, some vehicle, some police truck. Is that correct? Basically, what you're saying, that is not correct.
I wouldn't want to blame the police, but that is the only available means they're using. So
what you're telling people is that they should wait for help as much as possible.
Yes, we're trying to work with the police to make sure that we can bridge that gap. We're going to have drills with them. We're going to be working with them so that in case of that, we have, for example, us in Limia, we have our MCI, mass casualty incident protocols. What we do, instead of rushing the patient to the hospital, we bring a complete 16-bed hospital to the scene of an accident. It takes us 3 to 4 minutes to set up. We will do triage, treat, and transfer. So we will transfer people who are stable enough to go to the hospital. As I said earlier, we have the skills to stay and play. We can do anesthesia, blood transfusion.
You're basically moving the hospital to the patient. I think that's the concept you want to bring.
Yes.
You're moving the hospital to the patient. So we shouldn't over-interfere with whatever is happening.
Yes, exactly. And this concept was started by the US military in Vietnam, and it was picked up by UK.
Okay.
And when UK picked it up, it brought their survival rate from 45 to 87%.
80, okay.
So
So definitely Uganda can copy and also
Absolutely.
reach such levels.
yes,
And even the World Health Organization shows that there could be a 20% reduction in trauma mortality just with improved emergency trauma services, just with even only improvement of transportation ambulance services.
Very interesting. All right, so is there anything else people should be cautious about when they're dealing with an emergency?
So the most important thing is to call for help. Yes, that's the most important and will always be the most important thing. Yeah, to all of us, even I in the hospital, even the layman in the street, it's the most important.
Call for help, number
Yes.
one.
Yes.
And whether it is choke, whether it is what, call for help quickly.
Anything.
The first thing, call for help. Okay.
Yeah. And we are there to provide that help. Yeah, with our toll-free number. Yes, yeah, it's toll-free. No, you call us any time of the day, there is someone to provide you with that help. Yes.
all our dispatchers are trained and certified by the International Academy of Emergency Dispatch. They are not just people you pick and sit behind the phone. They are certified by International Academy of Emergency Dispatch. So anyone you can find in Europe is at the same standard as our dispatcher.
Very interesting. All right, so, I mean, yes, this is such a great initiative, and it will definitely save lots of lives of Ugandans. The loss of lives as a transporting someone who is injured, maybe you have had a broken leg and you're bleeding out. By the time you get to hospital, well, you have no blood, then what will you find? There's no blood, there's no drugs, there's no nothing.
Yes.
I
And
mean,
also
basically, the process to
Yes.
save your life
That's exactly
is
what
delayed.
we want to bring
Yes.
here, is that emergency care is more than an ambulance service. When you call us, don't expect us to come and pick your patient and take them wherever. We
You are
bring,
giving the care to
yes,
the patient.
the hospital, and that's the most important thing.
And what we do when we bring, it's not only us doing there, we coordinate with the receiving physician or hospitals, so that if we start a blood transfusion and we're taking you to, let's say, one of the major hospitals in Kampala, we will tell them we have a code red patient, so they already have the blood ready to start to continue the blood transfusion that we started in the field, rather than bringing you and either they don't have space in theater or in the ICU. So we have a coordinated
So you have
system.
like a network already
Yes.
for hospitals to work
Yes.
with. So even if
Hospitals,
someone
police.
so even if someone is in Luero, how would you do it? Like a distance place?
we would give you, of course, we want to grow outside, but we will give them instructions on how to deal with that emergency. But those ones, we will encourage them and give them instructions on how they can carry that patient to the next.
At least what care they can give.
Yeah, they can
we
give
can even try to call the nearby
health first. If they have an ambulance, they can respond.
Okay.
Yeah. And then if they need definitive care in Kampala, then we will dispatch to have them picked up. But God willing, in the next few months, we should be out there.
I think in the future, we'll be seeing things like helicopter services. I think that's what it also includes.
That's our
Even if someone is as far as Kotido, they can get you to
that's
the
our
nearest hospital within a few minutes.
That's our midterm goal. We should be able to reach every single Ugandan within 30 minutes.
So you've had the do's and don'ts. First thing, call for help immediately and get the person on the end of the line will give you the appropriate instructions on what you should do. Do not malhandle the patient. I mean, this is very, very important, especially for accident victims. If they have been involved in an accident, you have no idea what kind of injuries they have. So do not just move them anyhow. Call for help and they tell you what you should do. If the patient is bleeding, they will still tell you what you should do, how you should stop the bleeding as you wait for help. So I thank you very much, Dr. Hawa and Mr. Mugisha, for giving us this very interesting talk on pre-hospital emergency services. And I'm definitely sure, and I'm optimistic that it will grow and become, you're going to become I think when it eventually is established, we shall even call ourselves a first world country, right? Absolutely. Yes, yeah, because that way lots of lives will be saved. Hospital care will be top-notch and everything will be perfect. All right, so thank you very much. Again, I'm your host for the evening, Dr. Darius Owachi. If you have any questions regarding emergency medicine, pre-hospital emergency care, call for help and that's it.
Yes, you can even call us for any other information.
Regarding any emergency.
Yes. Sometimes it may not be an emergency, it could be fever, headache. We can still help with those.
Okay,
yeah.
okay.
Yeah, and it's not what you think is an emergency. People who exhibit symptoms of a heart attack, actually, a layman will not call that an emergency.
Yeah. So till next time, we'll see you on the Doctalk show. Please stay blessed. Send in your questions on our social media platforms. We'll be so happy to hear from you. For now,